A 25-year-old woman presents to the clinic requesting an abortion. She is currently 10 weeks pregnant and reports that she is experiencing severe nausea and vomiting, which have significantly impacted her ability to work and carry out daily activities. She states that she has tried various remedies for morning sickness, but nothing has provided relief. Upon further questioning, she expresses concerns about her mental health and emotional well-being if the pregnancy were to continue. What is the most likely diagnosis for the patient's condition? A. Hyperemesis gravidarum. B. Ectopic pregnancy. C. Placental abruption. D. Preeclampsia. Answer: A. Hyperemesis gravidarum. Explanation: the patient's symptoms of severe nausea and vomiting, particularly if not responsive to conventional treatments, are consistent with hyperemesis gravidarum, a condition characterized by excessive vomiting during pregnancy. Clinical scenario: a 30-year-old woman presents to the emergency department with vaginal bleeding and abdominal pain. She reports a history of irregular menstrual cycles and contraceptive non-compliance. On examination, she appears pale and diaphoretic. Ultrasound reveals an empty uterus and fluid in the cul-de-sac. What is the most likely diagnosis for the patient's condition? A. Threatened abortion. B. Inevitable abortion. C. Complete abortion. D. Ectopic pregnancy. Answer: D. Ectopic pregnancy. Explanation: the clinical presentation of vaginal bleeding, abdominal pain, and an empty uterus on ultrasound, along with a history of irregular menstrual cycles and contraceptive non-compliance, is highly suggestive of an ectopic pregnancy. Clinical scenario: a 20-year-old woman presents to the clinic for a medication abortion. She is currently 8 weeks pregnant and has opted for a medical termination of pregnancy. After receiving the first dose of mifepristone, she returns to the clinic 48 hours later for the second dose of misoprostol. However, she reports minimal bleeding and cramping since taking the mifepristone. What is the most appropriate management strategy in this situation? A. Repeat the dose of mifepristone. B. Proceed with the administration of misoprostol. C. Perform a surgical abortion. D. Continue to monitor the patient and provide supportive care. Answer: B. Proceed with the administration of misoprostol. Explanation: in a medication abortion, if minimal bleeding and cramping occur after the administration of mifepristone, the next step is to proceed with the administration of misoprostol to complete the termination of pregnancy. Clinical scenario: a 35-year-old woman presents to the clinic for a surgical abortion. She is currently 16 weeks pregnant and has opted for a dilation and evacuation (D&E) procedure. During the procedure, the physician encounters difficulty with cervical dilation and excessive bleeding. What complication is the patient most likely experiencing? A. Uterine perforation. B. Cervical lacerations. C. Retained products of conception. D. Hemorrhage. Answer: D. Hemorrhage. Explanation: excessive bleeding during a dilation and evacuation (D&E) procedure is concerning for hemorrhage, which may occur due to uterine atony or injury to blood vessels during the procedure. A 28-year-old woman presents to the clinic for a follow-up appointment after a surgical abortion. She underwent a suction aspiration abortion at 6 weeks gestation 2 weeks ago. She reports persistent lower abdominal pain and foul-smelling vaginal discharge since the procedure. What complication is the patient most likely experiencing? A. Endometritis. B. Cervical stenosis. C. Septic abortion. D. Acumen syndrome. Answer: C. Septic abortion. Explanation: persistent lower abdominal pain and foul-smelling vaginal discharge following a surgical abortion are concerning for septic abortion, which is an infection of the products of conception or the genital tract. This condition requires prompt evaluation and management with antibiotics. What is the average duration of pregnancy, calculated from the first day of the last menstrual period, LMP, to the estimated date of delivery, EDD? A. 36 weeks. B. 38 weeks. C. 40 weeks. D. 42 weeks. Answer: C. 40 weeks. Explanation: pregnancy typically lasts for about 40 weeks, calculated from the first day of the last menstrual period, LMP, to the estimated date of delivery, EDD.